uploading. Welcome, everyone. My name is Carolina Borges. I'm an associate professor of public health at the College of New Jersey. Today, I'm more than happy to have here with me Nicholas Acuna. He is a former student from TCNJ, and we're gonna have a talk about his career, how he's been doing in public health, and plans for the future. Thank you, Nick, for your time, and welcome to our video chat.
Yeah, thank you so much for having me.
Nick, can you tell us about who you are? A little bit about yourself, where you're from.
Absolutely, yeah. So as Dr. Borges mentioned, my name is Nicholas Acuna. I'm originally from New Jersey, so born and raised here. And so I started my undergraduate career at TCNJ, where I majored in biology and then minored in public health. And then I went and moved on to Rutgers School of Public Health to do my master's in public health in epidemiology.
And tell me, when did this idea of bringing public health to your studies started? How was that?
Yeah, so it's actually kind of funny how it all started. So it was my first year at TCNJ where I was, trying to figure out what courses to take to satisfy different requirements. And I also was interested in doing a minor. And when I was looking at the course catalog, actually, to look at different minors that the school offered, there was something new that I've never heard of in my life. And it was a category that said public health. So I was like, let me look into this. At that time, I wanted to go to medical school. And I was like, okay, this has something to do with healthcare, probably. And then I saw one of the courses listed as Introduction to Epidemiology. I have never heard of that term in my life, but I read the course description. And I was like, this sounds really interesting, something very different from what I was used to. So I decided to enroll in it my spring semester of my freshman year. And I ended up taking it with Dr. Seals back in 2015 now. And it was so interesting that you could, in epidemiology, sort of understand like health trends, both for like you follow diseases, you get to understand their etiology, prevention, treatment. And so there's so many different aspects that you get to look when you look at diseases. And I just thought it was so unique, the dynamics that are involved in it, the different study designs. And so that's kind of where my fascination came with public health. And then I started taking more courses within the department, which eventually became a department. So I started taking more courses to satisfy the minor. And I realized that public health wasn't just, the science. It's not just science. There's also like an activism piece, which I started learning more and more in my classes. And that kind of like it was more what my passion was and where my calling felt like it aligned with my values more, I would say. And so I started realizing that, I think epidemiology and public health was kind of more down the route that I was looking for and the impact, because for me, like, I envision public health, you're working with populations, whether it's like an institution, you're working with a community, or you're working with the state. There's a lot of different levels, and you're working with a large group of people that you can really invoke change in terms of their health. And so that really aligned with a lot what I wanted to do in the future. And that's kind of how my direction and how I kind of got into public health.
That's great. So assuming that I'm a undergrad, actually I'm becoming an undergraduate student, and I'm considering public health. Now people are talking about us, right? All the epidemics. So we're at the spotlight. So people talk about epidemiologists. Now people talk about it. So how would you tell me your first skills after this very beginning of your career in public health back at TCNJ? So what were, in rephrasing, what were the two or some skills that you gained as an undergraduate student by that time?
Yeah, so I think the really big thing that I had the opportunity to do was research. And I think especially if you're going to be moving up into higher education or moving into academia in the future, I think research is so critical. And not even just in general, like going into higher ed, but just general knowledge. I mean, now we're seeing on the news all of these studies coming left and right, and it's not just with, the times that we're going through, it's with all different diseases. So you see like studies on the news, like X food gives you a higher risk of this disease. And there's all these studies. And I think doing research and really understanding like methods of how research is done is super important, because then you can kind of understand what are the researchers trying to tell you, and what is actually true, and what is assumptions that they're making based on what they're telling you. So I think research at TCNJ was so critical because, I learned, how to do those basic like literature reviews. How do you become familiar with this topic that's so new to you? How do you read scientific papers to kind of get that baseline understanding of what you're even looking at, and then understanding the methods. And really, when you look at research, the results as well, like how do I interpret all these numbers? And I know for a lot of people, they're just turned away by numbers, but they're so important. They tell you a huge story. So I think being able to, be a part of TCNJ's research programs, whether it was in the Department of Biology or the Department of Public Health, really strengthen those skill sets that are so critical, especially now more than ever, where we need to understand and be able to communicate research effectively to people.
Yeah, that's great. And you are a master of public health, epidemiology,
Correct.
right? You're an epidemiologist. You became our colleague, which is
Yeah.
great. And we
Yeah.
love that. Another advantage of coming from small schools that we know our students. So can you talk a little bit about that, to your experience attending a small college?
Yeah, so that was the big reason why I ended up going to TCNJ, is because I love that small college environment, and I really wanted to get, that relationship with faculty members that is so critical. I didn't want to go to in the beginning, such a large institution where I would just be, one of 300 students in a lecture hall. I wanted to be able to collaborate and really get to network and get to know professors and their experiences. And that was something very unique to TCNJ. So for me, when I was at TCNJ, I was able to work with, I was in research methods with Dr. Seals, and she mentioned to me that one of the other faculty members, Dr. D'Souza, was doing research, and I was able to connect with her. And, we would have weekly meetings where we just sit down and we would have these conversations about, what her research project she was doing, and how do we analyze and interpret this data. So really getting that one-on-one experience. And, you get that throughout TCNJ and all of your different classes. Your class sizes are really not that big, to be honest. And you have the office hours that professors are just waiting for students to come talk to them. And so all of those different components and taking advantage of those are super important as well. So showing up to office hours, talking to your professors, and that just really made the experience that much better and helped me figure out and talk to other faculty members where I should go, how to best approach different situations, and how to really help find those skills based on what I wanted to do in the future. And it was such a unique experience. And, TCNJ is just a gem. I loved my experience, and, like I mentioned, the department was pretty small, and it's still relatively, all the departments are small, where you get to have that connection with faculty.
That's great. And what would you say to a senior, TCNJ senior student who
Mhm.
is preparing to apply for a big university, as you applied and you got in a great school of public health for your master's? What would you tell to
Yeah. Yeah, so I think for me, I was very nervous because I was going from, a relatively small liberal arts college to like a big institution. And so I think for me, it was figuring out what I wanted to do. When you start going to these big institutions, there's a lot of different resources and opportunities that are available at these institutions. So it's really figuring out what your priorities are, and then just putting yourself out there. That's like a really big component for you to kind of make a name for yourself, for people to start to get to know you. You need to get yourself out there. And really there's a lot of different opportunities, and try not to close any doors. I mean, for me, when I started at my new institution, I was approached to do a research project that I wasn't necessarily interested in, right? But then I accepted it because I was like, you know what? I feel like I'm going to get a lot of different skills from this experience. And I'm still working with that same faculty member on those research projects. And I learned a lot. I've learned how to, write manuscripts. I've learned to write grants. I've learned to use different statistical programming to learn all of these different analyses that I needed to do. And I was able to network. So don't turn down any opportunities and just focus on what you want to do, because there's a lot of different stuff out there. And don't be afraid to reach out. I think that's something that I was always afraid of doing, was like telling or going out of my way to send a cold email to a faculty member saying, hey, can we meet? I'm interested in what you're doing. And so that was something different that I really didn't have to do. And so at a big institution, there's thousands of students. So just send an email out to a faculty member and set up a meeting with them to really get an idea of what the projects that they're working on. Because like on the school's websites, every faculty member have their research interests. And if something sparks interest to you, I would definitely recommend reaching out and just having a phone call with them or a meeting to see what they're doing and see how you can get involved as well.
Being open. So it's important being open to opportunities, not just waiting the opportunity coming to knock your door.
Absolutely. I think that was the biggest change when I started going into a graduate program, is that you need to really be proactive. You need to put yourself out there. You need to do the research, because there is opportunities out there, but you just need to find it. And so that was a huge change, and just being very proactive throughout the process.
Great, that's excellent. If I'm writing my letter of purpose, or the letter to put my application there, what would you tell me, or what are your advices when writing a rock star letter of a purpose or a personal statement? Do you remember yours?
Yes, that is a huge piece, especially when you're applying to graduate programs. I think that holds a lot of weight, because it does give the reviewers on the admissions committee kind of an inside look on who you are as an applicant beyond all of the amazing achievements that people do in the research. So for me, so my applications were due around December 1st. Around that time, I started at least a draft outline of what I was trying to think about doing by like the end of the summer. So after I finished my GREs, by the end of the summer, I was already thinking about what did I want to talk about? What did I want to highlight about me? And to kind of write, and each school is so different. So like, it's not like, it kind of makes you miss the Common App when you apply to undergrad, because each school will have their own personal statement and what they're kind of looking for. But in general, most of the schools are looking for, talk a little bit about yourself. Why did you choose public health? Your research experience very briefly, and then why our institution? And so for me, I kind of started thinking about, okay, I was interested in disparities work. And so you have to really also figure out like a story to connect you to the research topic that you're interested in. And so for me, it was kind of, giving a glimpse of who I am as a person, my personal life, and not giving too much information, but enough for them to understand where I'm coming from and why am I interested in this topic. And then I segued into the research. And so for me, all of my research experiences were kind of different, very different. So I did research with Dr. Borges, I did research with you and Dr. D'Souza looking at quality of life and depression among older adults. But I was also doing research in plant genetics. And then I did research with Dr. Perry Halkitis and looking at LGBT and HIV disparities. And then I went to smoking cessation among correction populations. So all of these different research experiences were so different, but I had to figure out a story to bring them all together and try to show doctoral, admissions committee members, how did I take each of those experiences and put them together into this final what I'm looking for, what kind of training and research, and how did this all come together. And then I kind of finished off my personal statements with um, why their institutions. So I did a lot of research so each school had to be very different. Each school offered different things. So for me, I was interested in cancer research. And so specifically, I would talk about, if the school was affiliated with a National Cancer Institute designated comprehensive cancer center, and seeing those opportunities. Did they have a cancer control prevention program at their cancer center? Did the faculty members did a lot of their faculty members do research that I wanted to do? And what kind of training do they offer for their students? And so I talked a little bit about unique stuff that the school had to offer for students. And so that's kind of like, and then, just reiterating, how did you get to, point A to point B to where you are, and what do you want to do with that degree? So for me personally, like, I wanted to go down the academia pipeline. So I want to continue, going to a PhD program and then going to a postdoc and then afterwards faculty position. And so being able to show them that this is what I want to do with my PhD also helps out a lot in your personal statement.
That is great. And that's all great information for our students. Thank you, Nick. And now I would like to talk about a little bit about your the newest accomplishment. So your PhD, so you're building a beautiful path in public health. As you're saying, your goal is to become researcher. You're a researcher already, but faculty, that's why you decided to go for a PhD. Could you talk a little bit about this your next level step of your career?
Yeah, so right now, I think I'm currently working at Rutgers right now as a research assistant in a lab. And so right now, it's really just getting a lot of manuscripts. And that's something I will always mention when you go to doctoral programs. It's for you to kind of have that like backup, or that, as I like to think of it, as currency to show the level doctoral. You need to have publications. That is so important because it shows your contribution to the scientific community. So for me right now, it's really just trying to get a lot of different manuscripts out there on the research projects that I've been working on, and then moving into the doctoral program. And I'm going to be applying for what are known as pre-doctoral fellowships, so F31s, as you move down the career pipeline, and writing my own grant to support my research project. So while my doctoral program has the funding for me, having a grant from like NCI is so important and holds a lot of weight. So when I do apply for doctoral programs, postdocs, that will hold a lot of weight. That, I was able to write my own grant from A through Z, and then be able to show this is my research project that I thought out from, the preliminary research question. What am I going to do for analyses, and how am I going to disseminate the findings of my research project? So, that's my next goal, would be to really use all the skills that I've learned now to apply to an F31.
Okay. And what's the biggest area that you are targeting?
So moving into my doctoral program, I'm interested in unifying cancer epidemiology with that genetic component. I am a firm believer that for us to kind of get that complete picture within cancer, we need to not only think about the molecular level, but also our built environment and how that impacts us. So that environment can mean the actual physical environment, or it can be our social environment. So I'm interested in unifying all these like psychosocial and demographical information with our molecular information, unifying it to tell that story of cancer, and particularly looking at Latino communities. So I really want to focus on cancer health disparities and address those, and try to disseminate findings to different faculty members or stakeholders to kind of change interventions or what we should be doing in terms of, outreach for populations.
That's great. That's great. And we need this type of research. We need to understand more.
Mm-hmm.
And thinking about all your paths, Nick, what were the biggest challenges so far? So from thinking about looking back and seeing where you're going, what were uh, the challenges?
Yeah. So I think for me, it was, I know in my master's program, the hardest thing was for me is that my program was built so that students were able to work during the day and they would take classes at night. And so the hardest thing for me was trying to balance both of those at the same time. You know, when I was at TCNJ, I didn't really have a lot of commitment other than my coursework. That was like my main focus. But once you move to your master's level, being able to balance both is such a huge, you know, and it's such a huge change. And it was difficult for me to kind of adjust to a different lifestyle. And so being able to time manage, and so that I was like, okay, from, you know, 9 to 5, I was, you know, working all day, but then my classes started from 6 to 8. So where did I incorporate homework? How did I study for my exams when I had such a big block of my day dedicated to working? And so being able to find different mechanisms for me to kind of say, okay, during this time block, I'm going to, you know, work on homework or I'm going to study for an exam. So, you know, I would download like Google Chrome extension, so Momentum, where I would have my to-do list for the day. I would have my planner, calendar on your, whether it's on Google, on Microsoft Office, using that calendar to block out and really plan out your day is super critical. And it's such a helpful resource for you to kind of get everything lined up when you need it to get done. Another challenge for me was learning to write. And it sounds so simple, right? You're like, oh, but you know, that didn't you have to write essays in college? Like, how are you not good? And so for me, as I moved into epidemiology, I'm more of a quantitative person. I'm not a big writer. So for me to switch from, you know, writing essays to now scientific writing, which is so different, is
Oh,
such an also a huge challenge. And so learning the language and how to effectively get the message that you want in scientific writing is so different. And so reading a lot of different manuscripts and seeing what kind of flow, how did they write a cogent manuscript, and kind of the language is important. And so that was a huge struggle for me at the beginning. But, you know, luckily I had a really great mentor who kind of took me under the wings and was like, just start writing and we're going to go through what you wrote line by line and how do we make this into scientific writing. So that was super helpful for me. I mean, I have, even to this day, I'm still learning how to write. Like, I have a stack on my desk of manuscripts that I just kind of keep up. And I'm like, okay, how are these people writing? How can I incorporate in this to my own line of work? So that was, and also grant writing, which is another different writing than scientific writing. And so those were very huge and big challenges for me, because every word that you say matters. And so, you know, you're only given a certain amount of words to use, or you have, uh, you know, that was the big thing, certain amount of words to use. So every word matters. So
yeah.
that was a huge struggle for me, especially somebody who's very quantitative. Being able to write all of this out was a challenge, but it takes time, and it's something that I'm still learning to this day.
Yeah, and we learn by doing, right? As you were saying, I remember my first drafts when they came from my mentors. Terrible, and all
Uh-huh.
the edits there, and I was, oh my gosh, it's terrible. And they told me, hey, we only learn by doing. So this
Hmm.
is what you're telling us, that if we do not practice, it's impossible to learn how to really to write, because the challenge when writing science is to be extremely concise, very
Hmm.
objective, as you're saying about grants. Sometimes we just have a page, 2 pages
Yeah.
to convince, right? To show the importance, and to defend that idea, and just using 2 pages, right?
Yeah, it's such a difficult thing. And what I will tell people is to not be discouraged, because while your mentors are going to edit, delete, they'll delete paragraphs and you spend hours, don't take it personally. And that's something that I've learned throughout this process, is that you need to separate personal from professional, right? And so whatever they do to your writing or whatever you produce, one of your deliverables for anything that you do, do not take anything personally. It's them working to make you better at what you're doing right now. And it's only coming from a good place. So that's something that I will say is, so now when my mentor sends me something and I see, the edits throughout with track changes, I'm like, okay, you know what? Let's see what happened and, learn from it, because everything is, meant to help you in the end of the day.
That's great, Nick. I appreciate all these valuable tips, and it was our conversation. I'm checking the clock here, so and it was so good that I couldn't really track, and it's been how many minutes we're here? I don't know, for more 40 minutes or so.
Mm-hmm.
So the last thing, where I know that this question is so cliche, but I want to ask you, how and where do you see yourself in 5 years from
In
now?
12 years. Yeah, so that's a great question. Got a lot of those in my interviews.
Yeah, five
But
years.
yeah, so I would say in the next 5 years, I am hoping to defend my dissertation. I'm hoping to be at that very tail end of my doctoral program, and having mastered a lot of different skills, both in cancer epidemiology and genetic epidemiology. And then hopefully applying to postdoctoral programs, at various institutions, to really be able to take all of the skills that I learned in a doctoral program and apply them to my own research projects, and kind of run with it and spend 2 years just really focusing on fine tuning those skills, and then leading up into applying to faculty positions. That is hopefully the end goal within the next 5 to 10 years.
And you get there. I bet you will. Thank
Thank
you
you.
very, very much for your time. Thank you for working together with us. And by the way, we have a almost accepted paper. It's
Uh-huh.
coming, your project, and also time takes time. Good things in life takes
Yes,
time.
it takes time. Absolutely.
Time. All right, Nick. Keep in touch. Pleasure
Absolutely.
having you here, and I hope to talk to you soon. Bye.
Absolutely. Thank you so much, Dr. Borges.